Hi there, good afternoon. This video is for healthcare providers in the state of Oregon. And I am making the video as an update to the coming War on Melanoma that is going to happen on May 18th, 2019. That's only 3 months away, I can't believe it. And at that time, we are going to launch a statewide campaign to tell patients, not to tell patients, that's wrong, to tell the average individual who doesn't even know that they care anything about the skin to look at their skin and see if they see anything funny, and if they do, to get it checked out, to act, to do something about that, to make sure that it's okay. It's kind of like a Got Milk campaign in a lot of ways, but it's for looking at your skin. And the premise behind it is that we know that if people are just self-aware of their skin, the seriousness of melanoma and skin cancer that gets identified is substantially diminished, and the mortality from the melanoma drops significantly when we catch it early. So the idea is it's an early detection campaign, but it's done as an experiment. So as we are doing this, we are measuring at baseline and after the campaign to get people to look. We're measuring whether the cost of medical care for melanoma, whether the death due to melanoma, and whether the literacy about melanoma is improving after the campaign. So we'll know whether or not we've really had any impact or made any difference. Now the thing about it is that for providers, there's a chance that you may be asked by your patients to do more skin exams or more examination of a concerning lesion than you've done in the recent past. And so we want everybody to be prepared for that in case that happens. And we're going to have a landing page website where we send everybody who has a concern after they've seen this campaign. If you have something, go to this website and find different ways, different solutions for what your concern or problem is. And so some of that is a link to a dermatologist, a board-certified dermatologist. We're linking that to the American Academy of Dermatology site. Some of it is to be able to find a PCP. Some of it is to do a self-education, to look at some pictures, to see if you think it's something bad. Some of it is to look at, to download Mole Mapper. It's an app that can allow you to track your mole over time. One of the solutions is to do an e-visit. So there's a lot of different ways that any given person may be choosing to do that. But we want to make sure that if they're contacting their provider, that their provider feels comfortable that they've had a chance to be sort of updated, get a booster shot in terms of their understanding of what skin cancer looks like and how to detect it. So we've created a curriculum, and that curriculum is going to go live very soon, right before the May event. And we're also going to have an in-person CME event at the May event on the waterfront. It's down at the Robertson Life Sciences building on May 18th, Saturday, May 18th, Armed Services Day for the War on Melanoma. And so we're gonna have that available. And I would love to hear back from all the providers that have any concerns or questions or suggestions, anything that's going to help to make this run more smoothly and more efficiently. We're still collecting that data. We've been out, I've done CMEs all over the state now, and I've gone to Coos Bay, and we've been to Klamath Falls, and we've been to Salem, and we've been to several places around Portland, and we've been to Bend. And so we're trying to do these CMEs in person as well as online. Online is maybe more convenient, I guess, for some people, because you can do it on your own time. But we hope that you'll join us, and if you want to be listed as a PCP who has done our coursework and wants to be listed as someone who's done the coursework on our website, we're happy to try to include you on that as well. Just let us know. You can contact me at waronmelanoma@ohsu.edu, and just let us know who you are and what your question, suggestion, anything is, and we'll look forward to seeing you. Bye.